Now, we have an illustration showing us two types of rhinoplasty surgery, open versus closed. What's the difference for the patient, and how does the procedure differentiate for each type?
So this is a really important picture because it's not really two types of surgery, it's two types of it's a means to an end. It's a technique that the open rhinoplasty, you see there's a little inverse V where you make an incision. It's a technique to get to the means. So in Miami and in a lot of with a lot of doctors, what happens is they only learned how to do the open technique. So the technique is for people who have wide tips. It's if people have had rhinoplasty before and they have to be redone, or that you need to do grafting. It's done for people with thick noses that want really defined tips. The closed technique, which is doing all the incisions inside the nose, also is a technique that's used very well, but it's no longer taught that much. So what happens is people who only do the open technique are really they're doing a surgery that really doesn't need to be done on everybody.
Why isn't it taught that much then?
Because a lot of people don't do a lot of rhinoplasty. It's a safer procedure for someone who does. It's sort of like a crutch. It's like it's safer for people who don't do surgery often, so they don't have as many problems. But for the person who comes in who has a bump, a little wide nose, and has a nice tip, there's no reason to do it. And so the problem is, and this is what I often tell a lot of my patients, or I write a column in the Miami Herald, is you should ask your doctor, do you do both? Because it's like going to it's like having a hammer. If you have a hammer, everything's a nail, right? So if you have other tools in your armamentarium, you're going to be able to do other things.